Welcome to the Healers Café, the #1 show for medical practitioners and holistic healers to have heart-to-heart conversations about their day-to-day lives while sharing their expertise for improving your health and wellness. So welcome to the Healers Café. And today I have with me Dr. David Berger. He's a board-certified pediatrician with more than 25 years of clinical experience or clinician experience, and has gained a national reputation for his expertise in holistic pediatric primary care, something we desperately need, with specialties in nutritional and lifestyle therapies for autism, ADHD, and related disorders, as well as immune dysregulation, such as allergies, asthma, and autoimmune disorders. So, well, I'm really looking forward to asking you a whole bunch of questions, but
I'm here for you.
the first one I'd like to ask you is, so how did you know that you wanted to go in this field? What happened?
Okay. Well, I was incredibly fortunate as a child to have a pediatrician who was like a godfather to us. He was like a godfather to the entire community. And just the care, the compassion, the relationship he had with my parents, with us, we were the most important people in the world whenever we were with him. And supposedly, when I was about 4 or 5 years old, I told him that I was going to be a pediatrician like him someday. And that was it. And up until one semester in college, when I told my parents that this is after I got into medical school, that maybe I wanted to be a sports reporter instead, and which my parents later told me that while they internally freaked out, they did everything that they could to be steady for me. They freaked out when they got back to the hotel. That was the one moment where I decided after a few days nap, maybe I should go back into go to medicine after all. But so I always knew I wanted to be a pediatrician. Even like when I went to medical school, like, oh, you're here to be a doctor. I'm like, no, please let me clarify. I'm here to be a pediatrician. And so that was really the only thing that I ever really wanted to do. If I could be like him, if I could have an impact on other children, if I can help other families and impact the most delicate resources of our country, helping with our kids. It was just something that I've always wanted to do.
Mm. Yeah, and I mean it's the most important group, if we're
Yeah.
looking health in general with, deteriorating all kinds of conditions and diseases, we have to look at what are the contributing factors, right? And certainly, what we eat, what we breathe, where we live, what we put in our bodies, the medicines we take, the injections, all of that has a role that could be played, and it's changed massively. I was looking at 1960s. We had a few shots, right? And now, like, I think in the US, I don't know how many it is, but it's an enormous amount of of injections that are normal to take. And so our version of normal has changed a lot. And so I wanted to know your opinion on that. I know you have many factors that you look at, I'm sure. And I'm by no means saying there's only one thing going on here, but what is I mean, how many parents care about this change? Is this an issue?
Okay, so I'll start off by saying that I first and foremost am somebody who is pro-choice when it comes to all things related to what goes into the human body or what goes out of the human body. And so it's a very libertarian view, I believe, that people should be able to make their own decisions. Parents should be able to make their own decisions on everything, from whether it's how we educate our children, how we feed our children, what medicines we put into them. Obviously the impact that how we behave around our kids and the mental health impact that may help, how we as parents identify potentially any behavioral or mental health issues and how we respond. And so it's both the right and responsibility for us to do that. So when I talk to parents about vaccines, and certainly I have parents who talk, who bring up the point that that you mentioned in terms of the number of vaccines given now compared to 50 years ago or more. And it's certainly the number has increased because they've come up with more vaccines, and obviously the CDC approved it, and everything that goes forward with it. But at the end of the day, what I tell a parent is just like, whatever you think is in the best interest for your child to do is what we'll do, and I'll explain how to do it or not do it as safely as possible. So whether a family chooses to do all, none, some, split, delayed for vaccines, from my perspective, that's their choice, and I'm going to support them in their decision regardless of how it is.
Mhm. Yeah, no, I share that point of view, because if it's not the parents who make the choice, then they sort of abdicate the responsibility to be informed. And the whole idea is to have informed consent. You
Yeah.
know, if they don't look it up, if they don't ask questions, if they don't have the relationship with their pediatrician where it's safe to ask and and safe to get feedback and to look into it, I think it's very challenging. And I certainly know, many families who have been lost because it's a non-questioned aspect of our education, right?
Yeah,
So
if
is
you're not,
nutrition.
it's not informed consent. If you're not informed, then it's just consent.
Exactly, exactly. And I think as a population, we had a big lesson in that in the recent years, to
Certainly.
let's get informed, so that we can make intelligent decisions. And when you say you're doing also nutrition, now nutrition is not something typically taught in medical school. I think it was like 11 hours. I did an average of curriculums,
Yeah, it was 10 for me back in the 90s. Yeah.
Okay, so what can you tell us about the importance of nutrition and how, I mean, there's so many different theories. I mean, I'm talking about real food. I'm not talking about junk food or what's not food, but of real food. We're in a population that I'm seeing of more and more allergic people, right? So kids are more allergic than their parents, and it seems to go on like this. So how do you deal with that? Because that's a big question I get asked all the time.
Yeah, certainly. So, well, first of all, it's multi-pronged, okay? And
Mhm.
and any conversation that doesn't start with breastfeeding is missing a very important point. Because we know how much and faster and complete the intestinal lining of a newborn during those first few months develop when exposed to breast milk, and the proteins and all the factors that are there that are not found in formula, that it's profound. If you compare the intestinal lining of a 6-month-old breastfed versus formula baby, a breastfed baby almost looks like a mature adult, and a 6-month-old formula fed baby looks like a newborn. So, and when we talk about developing the intestinal lining, the integrity of the lining, the impermeability of the intestines as it's supposed to be, when we talk about leaky gut being a permeable intestinal barrier, it's incredibly important. We know that, I mean, there's so many studies that have shown lower allergies and lower asthma, eczema in
Mhm.
breast milk. In fact, I actually have people apply breast milk to kids if they have asthma. It can be a great remedy in and of itself. So that's really obviously one of the first things. Okay. Of course, very often if a baby is not breastfed, what are they given? Cow milk formula. Now, in our practice, we mostly use goat milk formula for babies who are not breastfeeding, but the overwhelming majority of our patients also are breastfeeding, and majority are still breastfeeding past a year, if not longer. So, part of, being a holistic pediatrician, there is a bit of preaching to my choir because people seek me out because of the services that I provide. People either will come to me because they have problems and they need to reverse it, or they come to me because we all walk the walk and talk the talk together. So kind of two different populations, but it's not that big of a stretch for me to talk to my patients about this, because this is why they're coming. It's like, why do so many people who walk out of an eye doctor get glasses? Well, why do you go to the eye doctor in the first place? So it's
Right.
one of those things that I clearly found that. But when it comes to then starting to introduce baby food, and what is the most common thing that parents are told? Give your kid rice cereal. There's no nutritional value except for some fiber in rice cereal, and you got to concern yourself with arsenic. So I don't do that at all. In fact, I don't even start with fruits except for avocado. I talk about bringing in avocados and vegetables first. I actually don't want to develop a sweet tooth with the fruits and the applesauce, as kids may not like green beans if they've had the applesauce first. So I like to introduce one food in every 4 days so that we can watch for a negative reaction, allowing for combinations of two foods that are previously tolerated alone. I do encourage people, not that I want peanuts to be a staple of the diet, but because of peanut allergies, we know that introducing earlier as opposed to later, like we were used to be taught, can make a big difference in terms of not having peanut allergies. But then I like to bring in other real nuts and seeds and other types of things. Obviously, not the nut itself, but a powder or a butter or something like that in order to do that. And then really, we don't talk about bringing in packaged foods and sweets and stuff like that. It's going to happen when they go to birthday parties, we realize. But again, most of my patients are doing that. So that's a big part of it. But also, one of the things that I really focus on is preconception and pregnancy health of the woman, and making sure that they have adequate vitamin D and zinc levels and a nice microbiome themselves, because that can have a very big impact if you're born with a with a nice amount of vitamin D and zinc. I start all babies on 400 to 500 units of vitamin D the first week of their life. And I check everybody's vitamin D level at 1 year old, along with their zinc levels and their iron levels. I check methylation genetics to see what their MTHFR and related genes are to make sure that they're on the right forms of B vitamins. And all of this we do at 1 year old. Sooner if we
Right.
have problems. So that's kind of really the beginning of the pathway forward, to me, in my opinion, to setting the child right.
Mm. And what about with meats? I don't mean big commercial, with antibiotics and whatever
Right.
else,
Yeah.
but farmed.
Yeah,
Um,
absolutely. So of course we talk about healthy foods and healthier options of things. But certainly, yeah, I typically will bring in in fact, I actually tell people to bring the meats before the fruits, but and then before the grains. So I like to bring them, but obviously with everything, so I realize not everybody can get access or can afford all
right.
organic foods, etc. So, I talked to them early about the environmental work groups Clean 15 Dirty Dozen list, so that if everything can't be organic, at least how to choose better, less pesticide laden food by using those types of lists.
Mhm, mhm. Now, with your specialty in ADHD and all of those kind of disorders, why do you think that's the case? I mean, there was a movie, I think a few years ago, I tried to bring my kids to, my adult kids who have children, okay, to sort of influence them a little bit that maybe there's other perspectives on this than the denial that there's no such thing as ADHD, which is kind of, at least in Canada, that's what we hear. There's not, and certainly nothing causes it that we could do anything about. But anyway, this particular movie did talk about that a lot more. I don't think I'll say the movie's name just in case. But obviously you're treating it. So what is your what's your understanding of, yeah, how it happens? What can parents look at who are concerned about that?
Yeah, well, I can't say that we know why it happens. And in my perspective, whether you're talking about autism or ADD or other areas along the neurodevelopmental spectrum, I think that much of it can be minimized and can be prevented by doing some of the stuff that we talked about from the very beginning. Um, Maintaining those proper nutrients and everything before, avoiding toxins as much as possible. So I don't know, just a couple weeks ago, I'm actually going to be recording a video about it this weekend myself, about, we talked about things like plastics and BPA. And we've
Yeah.
known that BPA is a hormone disruptor. Well, a study just came out 2 weeks ago that showed that women who have the higher levels of BPAs in their body during pregnancy were 6 times more likely to have a child with autism, a son with autism, technically, having to do with the aromatase enzyme that's responsible for hormone metabolism and incredibly important during fetal development. 6-fold increase with the highest speed PA levels. And so, and that's not even talking about the other microplastics. It's not talking even about so many of the other things that are out there that are causing problems. So part of it is, I talk to people about clean food, clean water, clean air, keeping humidity down here, especially in Florida, to decrease mold growth. All of the, checking your houses for mold and obviously remediation. And that can be really tough because not a lot of people can afford what really needs to be done for that. But,
So we cut out a little bit on, I think the Wi-Fi went strange.
oh, sure. What the last thing you heard me say?
Yeah, about mold. Why mold? And if you could start with that, that'd be great.
Sure. So, the air that we breathe, especially, and I'm not, especially when it comes to things like molds and other toxins in the air. In Florida, we have a huge problem with mold, partly because of the humidity, because mold grows in higher humid climates. Partly because of a lot of the storms we have, so there's a lot of water damage that happens. I mean, all these people who have their homes damaged by the hurricanes, and they don't realize that, yeah, not just that, but all of the stuff that's behind the walls that doesn't get seen. So mycotoxins is a big thing. And how does our body properly clear them? What can we do to minimize the exposure that we're inhaling them, and if it's in our food supplies? So, all of these things are toxins, and obviously with modern world that we live in, a lot of these toxins were not there a couple of generations back.
What would your life be like if you were pain-free? If you were one of the millions who suffer from chronic pain, the thought of just one day without it may seem impossible. This is often because conventional medicine tends to fall short in the treatment of pain, opting to prescribe pills or recommend surgery rather than getting to the root cause of the problem. But if you are suffering with emotional or physical pain, there is hope. Join the founder and CEO of Bowen College, Manon Bolliger, live online for your body-mind reboot. Learn how to listen to your symptoms and get to the root cause of your pain. Plus, be trained in basic Bowen therapy moves so that you can reboot your body for optimal health. You don't have to live in pain. You can heal. Stop the pain pill cycle by visiting www.yourbodymindreboot.com to learn more and to register.
And so our bodies, we could not have possibly evolved in such a way to deal with the types of toxins that have been thrown at us from the past 150 years. So, evolution doesn't keep up that fast.
No, and I think if you add also, I was listening to Dr. Peter McCullough, who was quite featured with the heart issues, that we've seen in the last 3-4 years. He was quite outspoken there, and he's a cardiologist, I'm sure you know, but he was saying, when asked, also about autism and about childhood vaccines, he said, "Oh, it's funny, I never thought anything about it, but now that he's sort of seen what's happened here, he's looked back and looked into the research of that. And, when we say there's possibly toxicity in the shots, but the accumulation, I think he said there's like 108 vaccines, when in his time it would be 3. It was like a much larger amount. So the sheer amount of time zone without, we're not doing detoxes, and we're not doing a whole bunch of things to clear all this heavy metals. I don't know, I would think that it would have an impact, but at least that's my, my it's not my research, it's my reading different authors and going, wow, there's maybe something there that we need to look at again, and look at these studies, and and also the realizing that there's no studies that show all of these put together, the impact it has on the body, that I'm aware of anyways. It's not mixed, in the real way that babies take all this.
Mm-hmm. Right. So, I want people to also be clear, there aren't 107 different shots being given to the kids. Okay, so when a lot of the like those numbers that are used, for instance, like there's like the streptococcal pneumonia vaccine called Prevnar. It's there's 13 different substrains within it. Okay, and it's given typically 4 times. Okay, so I mean that's 52 right there, if my math was correct, right? So just so that the listener is not is understanding what that number means. That's so where it's 4 actual injections over time. So just to be clear about that.
I think that's a good point.
Yeah, but you see, my take on all of this is about inflammation and how our bodies are or are not able to handle inflammation. And I don't just mean being susceptible to allergies. I'm talking about enhanced inflammation, hyperinflammation that happens when the immune system is not tip top in terms of how to deal with it. So I like to talk about the Goldilocks aspect of things. Okay, we don't want an immune system too weak that makes us more susceptible to infections. We don't want an immune system too strong that makes us more susceptible to autoimmune diseases and allergies, asthma, eczema. We want it just right. We want it in the middle. One of the fascinating things for me, and if we want to talk specifically about the COVID vaccine, the similarity between many of the side effects of the vaccine mimic the negative symptoms and the potential long COVID symptoms from wild disease. And what I think is that obviously people went into 2 very different camps when it came to the conversation about COVID and the vaccines. And I think that there's kind of a lot of people are missing the really important thing. What's the commonality between the vaccine and the disease? Spike protein hitting ACE receptors, causing the immune response, the cytokine storm. Okay. And so whether we talk about myocarditis and pericarditis, yeah, it happened at the vaccine, happened with the disease too. A lot of the fatigue and a lot of the other types of things, they were seen at both. So the way that I look at it is that what are we able to do to allow the immune system to respond in such a way, and it's true with wild disease, to again create immunity for the future, and obviously herd immunity, natural immunity, and not let it go overboard. So although we heard, we did lose a family friend to COVID early on, obviously up in New York when 3,000 people were dying a day from it at the very beginning of it. That was obviously a terrible, horrible thing where I understand why corners were cut. I didn't agree with why corners were cut, but I also, we want to remember that decisions were being made when things were like insane, right? And so when Operation Warp Speed was offered by the government at the time, they cut all of these steps that would normally take place, right? And so it was rushed out. I was fortunate. I was invited to your audience and may know that I was one of the only physicians that I presented to the FDA at the emergency authorizations, the committee. I was chosen. I spoke in front of for the committee 3 different times when they brought out the Pfizer, then the Moderna, and then when they wanted to bring it out to kids. First thing I talked to them about is transparency. If you're not going to be transparent, upfront, and honest with people, you're going to lose people, and you're going to see a divide, which is exactly what happened. Second time when I was talking about after data was out was you're talking about a very few number of people in what you're quoting, and you're going to miss potentially more uncommon reactions. And you're not looking long enough for potential, obviously, for it as well. So but at the same time, those things were happening under both circumstances of wild disease and in the vaccinated state. So how do we make our immune system? Now, when people start to get sick, what do I recommend that they do? They increase their C, they increase their zinc levels. I put them on something, either echinacea or something called Larix, the bark of the western larch tree, which also has arabidogalactan, the same active ingredient as echinacea, and 2 days only of high dose vitamin A. What did I tell people to do to protect themselves for not just the COVID vaccine, but all vaccines? Did I lose you?
Yeah, you just said, and 2 days of,
2 days,
and then the
2 days of high dose vitamin A.
vitamin A.
Right.
Okay.
Never should one do high dose vitamin A for more than 2 days, but we do 2 doses twice a day for high dose vitamin A. But that's also the same, those things are the exact same thing that I recommend people do before they take a vaccine.
Yeah.
You know,
Yeah.
and then up through and then after the vaccine. So we are priming the immune system in such a way to deal with it all.
Mhm, mhm. I
And you
agree.
know, and we didn't see people have the vaccine reactions. We didn't see people. I mean, like not a single one member of our patients perished
Mhm.
from COVID, from wild disease. You know, so so we took a very different approach from the beginning.
Mhm. Yeah, definitely. And I think I agree with the medical way of looking at it, what you're saying on the level of we have to treat, the body can have an inflammatory reaction. We need to deal with that no matter what, whether it's natural or whether it's made in a lab. But I don't agree with the history of it completely because, Dr. David Martin has all the patents of it, already created in 2015. The PCR tests were already, available to everyone in 2018. Like, I think the history is very corrupt and complicated, and that's not the purpose of our discussion. But I just wanted to say that part I'm not in agreement with. But how we treat people is the same way. We have to, and this could happen with any new one that comes up. There's a current one that's coming up too. It's the same approach. We have to, whether it's a secondary effect, a type of shingles, or whether it's something, that was in the shots, or whether it's something that is coming out, we still have to help the person's immune system. And that's the same, my understanding is you would do the same thing, with upcoming conditions,
Yeah,
I
I mean,
mean,
to me, it's kind of a basic have the body in balance. The body can handle things a lot better.
exactly. Yeah. Well, our time is actually up, but I wanted to ask
Wow,
you.
we didn't get to talk about very much at all.
No, I know. We just went to well, we did cover it, a little bit, but I was going to say if I can leave you 5 minutes to maybe share something that I haven't asked you that you feel is really important, I would really appreciate that.
Yeah, we live in a consumer-driven society. One of the things that we've seen from COVID has happened to our society is obviously a lot of mistrust because a lot of people had previously just done what the medical profession told them to do, and it was and still is frowned upon to ask questions. My advice to any patient and to any parent is ask questions. If there's somebody who's not willing to answer your questions, seek somebody else.
Mhm.
It's important to have a partner in your health. Somebody who may not even agree with what you're saying, but is there to, is that person going to support you, or is that person going to throw you out of their practice because you've questioned what they've done? And anybody who, for me, I don't think it's a good clinician to not listen to what the person's saying because everybody has their own experience. Part of the problem is the medical system as a whole. At least here, if you spend more than 15 minutes with your doctor here, that's a lot of time. Well, I typically spend my every first appointment for me is an hour. And my follow-ups can range anywhere from 30 minutes to 75 minutes. And so we dig deep. We go really into all these things. Because, we didn't even talk today about things like healthy sleep. We didn't
Mm.
talk today about exercise and activities and other things that people could be going. And so, I spell holistic with the W because I look at the whole picture. That was
Yeah.
very intentional. And if you don't look at all of these things, I remember back in medical school, when we started learning about the different body systems, the cardiologist would come in and say, the heart's the most important part of the body. If you don't pump blood to everywhere, then you're not going to survive. Okay. The neurologist comes in. Well, the brain's the most important part of the body because if you don't have your neuronal aspects and your cognitive function there, you're not going to survive in this world. The GI doctor comes in. Well, the
Mm.
GI is the most important part of your body because it's where you get your nutrition and how you detoxify through your liver. And as each of these guys and women were parading through the lecture hall, I'm asking myself, do y'all talk to each other? Because your organs do. And so if if you're taking this singular system approach as opposed to a systematic approach where you look at the whole person, and you're not even talking about like the impacts of mental health on what that does to people's immune systems and what that does to other things of their ability to stay healthy. If you're depressed and you can't get out of bed, you're not exercising very much, you may not be eating very well, you may be in survival mode as opposed to thrival mode. And so it's such a reverse of like what we need. And you know, I've been doing this for 25 years with these types of approaches. And, you know, fortunately, I think the world has definitely changed. I mean, you know, I remember the day during the pandemic when Dr. Fauci said that he takes 5,000 units of vitamin D every day, which is 10 times the recommended daily allowance. Of which my first thought was like, thank God for saying that. And then I yelled at him, can you please say that every single day, every single time that you step in front of the camera from now on? Because I don't know how many people heard you, but that's the greatest advice that you've ever given. You know, and so, you know, we need to educate people. And again, now, especially with younger people, especially with parents that I deal with as a pediatrician, they're much more knowledgeable than parents were 20, 25 years ago. They have much more access to information. They're given the ability to ask questions more because we live in a more open society where people can pose questions on social media and things like that. So if the medical world doesn't keep up, people are going to continue to flock. But I will tell you this, something that I've noted, and this is also something that I think has happened with COVID. Even in the general community, medical community, I've noticed that there's been a lot of shift in the direction of more natural, holistic, functional medicine, healthy. I'm not the outcast that I was 20 years ago, but I haven't changed. Yeah. I think things have shifted, and obviously worlds don't shift just like that. But I have found that more physicians are referring to me, more therapists and other people are referring to me. We didn't even talk about medical cannabis. It's kind of funny that medical cannabis is actually, I think, what made me the most legit in the mainstream medical world, because that's what I get the most referrals for. And so, you know, the times they are a-changing, and, you know, the reason why I talk to people and do interviews like this and why I make myself available at the media and why I do my YouTube channel is to educate people. I realize that everybody can't come to see me, although I do as part of my health education consultation. So since I can only be a doctor for somebody in the state of Florida, since you have to be a Florida resident, since I have a Florida license, but I can serve as a health education coach, as consultant, etc., where I go over these things individually. I can't order things for people, but I certainly can talk about what I see and what I know.
Yeah, well, good for you for, you know, staying true to what you saw way back, you know, and I think that's also that level of integrity is what, you know, what we're looking for in a doctor, right? It's, you know, you can be right, you can be wrong, but you're truthful to yourself, and you know, people can talk to you. So I admire you.
Thank you.
All right, thank you so much for having this conversation. And yeah, we probably need a lot longer. I'd love to ask you more about cannabis too, but my audience kind of shuts off after half an hour. So
yeah, okay. Well, I'm always happy to talk again. If you want to do another specific topic on that, I'm happy to join you again.
Oh, that'd be fantastic, actually. Yeah, because a lot of people have questions on that. So
yeah, it's a big topic.
Yep. Okay, well, thank you so much for your time. Thank you for joining us at the Healers Café. If you haven't already done so, please like, comment, and subscribe with notifications on, as I post a new podcast every Wednesday with tons of useful information and tips for natural healing that you won't want to miss.